Alright guys, welcome back. Today we'll be covering the electrical conduction system of the heart. Starting off here, we will start with the sinoatrial node, better known as the SA node here. Sinoatrial node. Okay, so the SA node is located in the right atrium, and this is known as the pacemaker of the heart. So this is going to trigger atrial contraction, and this has an intrinsic rate, so a normal rate of 60 to 100 beats per minute. So this SA node is located right here. Okay, the second thing we will cover is what we call the Bachmann Bundle. Okay, and so the Bachmann Bundle is going to be here in red, and the function of the Bachmann Bundle is to transport the signal from the SA node, so from the right atrium to the left atrium, to make sure that both of the atria are contracting together. So transports signal for simultaneous atria contraction. Okay, so that's right there in red. So let's go ahead and label that as well. Okay, next is the atrioventricular node, also better known as the AV node. Atrioventricular node, and this is located right here. This is our AV node. Okay, and as far as function for the AV node, what the AV node is, it's going to briefly delay the signal from the SA node before sending it into the ventricles, and this just allows the ventricles more time to fill. So we'll write that here. Delay signal briefly for ventricles to fill. Already labeled it right there. Okay, the next thing we will discuss, the next step, is the bundle of His. Bundle of His. So this is located right here. This is your bundle of His. And the function of this is to carry that signal from the AV node into the interventricular septum. So this area right here in between there. So this is another one that's just a transport. So this carries the signal to interventricular septum there. All right, we have two more that we cover. The fifth one is going to be the left and right bundle branches. So we'll put bundle branches. This is left and right. Okay. So these branch off. So the right bundle branch is going to be this in here, all the way down, loop around. There's your right bundle branch, and your left bundle branch is this one here. We'll do in yellow or orange. Okay, so those are your right and left bundle branches. And then the last thing here is your Purkinje fibers. Purkinje. And the role of the Purkinje fibers, this is going to initiate that depolarization that is going to cause the ventricles to contract. So this depolarization that causes the contraction of the ventricles. And these, all these little branches here, these are your Purkinje fibers there. So this will cause those ventricles to contract and get that blood moving forward. So those are all your Purkinje fibers there. So those are the 6 that you'll need to know. Like I said, you're starting with the SA node. This is your intrinsic. It's got that value of 60 to 100 beats per minute. We do have some backup rates here in case, like let's say the SA node fails. Then that's when the AV node could take over as well. So the AV node is actually going to have an intrinsic rate of 40 to 60 beats per minute. And then even as a last resort thing, if your SA and AV node are not correlating or not working properly, your Purkinje fibers have a intrinsic rate of 20 to 40 beats per minute. So not adequate for, long-term sustainability, obviously, but maybe could buy you time until further intervention. Okay, so that's just a quick overview there. Like I said, the signal starts here in the SA node. So we'll do this all, and we'll go blue. In the SA node over here to Bachmann Bundle. That's going to cause the atria to contract at the same time. Carries down here to the AV node. From the AV node, bundle of His splits into your left and right bundle branches, and then finishes with your Purkinje fibers here, and that's what's going to cause the contraction of your ventricles. Okay, and that's just another quick overview there. If you liked it or enjoyed it, please subscribe to the channel, help it grow. I'd really appreciate it. Thank you.